Welcome back to Plastic Surgery Untold. Super exciting topic today with our two celebrity guests. We're going to talk about rhinoplasty, but really from a unique perspective of, liquid rhinoplasty versus surgical rhinoplasty. And it's a question we get all the time is which one's better for me and what can you really achieve from each of them? As you guys know, Dr. Weinfeld is a world-renowned rhinoplasty surgeon, and one of his absolute passions. Gilbert has really utilized the ultrasound to really maximize the safety and reproducible effects of a liquid rhinoplasty. But even with that, I still think there's some limitations, and we'll kind of talk about where the best place to go is. So do you guys want to kick us off? Maybe guide us a little bit through how you kind of make that decision of one procedure over the other?
Yeah, I guess I would start off by saying that perhaps we shouldn't think about it as versus, like one versus the other. I think and really is a good way to think about it, that in a practice, we have both a surgical rhinoplasty and a liquid rhinoplasty available to the patients, and it's incumbent upon us to help identify what procedure is going to meet the patient's needs, and then also obviously what can be done safely. So, I would say, and Gilbert knows a lot more about liquid rhinoplasty than I do, but I would say that, in my understanding experience, and I do have some personal experience, that liquid rhinoplasty does work really well for someone who has a hump or a bump and would like to straighten their nose. And also, I've seen some really wonderful work that they have been doing in lifting the tip of the nose as well. I'm certain that there are other things that can be done. And the concept there is that, essentially to get rid of a hump, at least temporarily, that it's being disguised by injecting some filler above and below. And you can correct me if I'm wrong. But anyway, so, that's an example of what can be done and done extremely well. But with a liquid rhinoplasty, you're always adding. So in someone who wants, an outright smaller nose, then a formal surgical rhinoplasty is going to be the way to address that better. And then also someone who has breathing difficulty, a liquid rhinoplasty may have some very subtle impact on breathing in a positive way, but not in the way that a rhinoplasty can improve breathing. So that's sort of my initial thoughts. Gilbert, definitely need to hear from you because you have so much wonderful experience and success with liquid rhinoplasties.
Yeah, thank you, sir. I think without question, there's nothing that's going to ever, take the place of a truly surgical rhinoplasty in terms of, the outcomes that you can get, the precision that you can get, the benefits both aesthetically and functionally that you can get from true rhinoplasty. I think with a liquid rhinoplasty, there's a few things that, we can improve upon, as you mentioned, camouflaging a little dorsal hump by adding some volume above and below, getting that tip to turn up and out a little bit to give it a little bit more tip projection and kind of create a little bit more of a dainty kind of feminine type tip. I think adding volume in the appropriate locations can sometimes make the nose look a little bit more narrow, but it's not going to make it look smaller, to your point, right? Some of the things that a liquid rhinoplasty cannot do is it cannot change the width of the nostrils or the base of the nose. That is truly a surgical approach that you need to take. And so I make sure that, when I'm consulting my patients, I listen to everything that it is that they're concerned about and everything that, they're hoping to achieve. And I am very transparent with them as far as what I can and cannot do with a liquid rhinoplasty. I think that for some patients, they have in their mind that they want to have a true rhinoplasty done, but they realize that it is it's a permanent solution. And sometimes that can be a little scary for them.
Yeah.
And so they may utilize the liquid rhinoplasty as a way to kind of just give themselves an idea of what outcomes could look like prior to committing to a true rhinoplasty.
Yeah, it's like dating before you get married.
I've loved that, and I've seen, especially in a lot of our men and in our male patients, where the liquid rhino has been literally a bridge for them. And so making sure it's something that they're going to be happy with in terms of that transition. Sometimes people are worried about it overly changing them. I love the point you made about kind of these plastic surgery pearls of how you're adding volume, but you can almost give the nose an illusion of being a little bit more narrow. And I always tell people it's kind of like if you think about a roof, if you're looking at a flat roof, it looks much wider than if it comes to a point. So it just adds kind of a little bit of, illusion to make it look a tiny touch slimmer. I think the sleeking slope also makes it sometimes look a little smaller, and also makes it look less hooked because you've now gotten rid of kind of that C curvature. You haven't truly gotten rid of it, but you've camouflaged that as well. And then I think the other big pro of a liquid rhino is everybody, especially right now with the transition of being harder for people to take time off work, people being afraid to be out of work for maybe too long. Liquid rhino, a lot of people can do on the afternoon, lunch hour, and be back to work that same day or next day, maybe a tiny touch of swelling. We always tell people any injectable, you could get some bruising, but that tends to be pretty minimal, especially with some of our vascular mapping stuff. So no question, the downtime with a liquid rhino is much less.
Yeah.
What about also the concept of, I've seen some patients who I've treated who had a rhinoplasty, maybe didn't quite get everything they wanted, but the differences of where they're trying to get to is so subtle, probably not worth the run for doing a full completion revision rhino. And some of those have done really well with just some fine little tweaks for liquid rhinoplasty.
Agreed. I have a lot of experience with that. I treat a couple of patients who had surgery elsewhere and were generally satisfied, but not completely satisfied, and have done some minor injections for them over the years, and they've been very, very happy. And then I have my own patients where there's just a little, like 5% more of a change that they want, maybe just to create a subtle increase in symmetry. And often that can be, bridge the gap between being super, super, super pleased and ecstatic about the result. And one thing I found with that is that often if you obviously we know, we haven't mentioned this, but like fillers are not permanent, but I found that if you inject twice into an area that needs just a little bit of volume, after that second injection, it seems to like stay forever, or at least, not forever. I haven't lived forever yet, but it seems to last a long time. Gilbert, what do you think?
I think I personally have not seen that, but I haven't really been looking for it either. Yeah. But I will say that, I think we can all agree that in areas where there's not a lot of, movement, muscle movement, filler does tend to stick around a lot longer. Yeah. Like the nose versus, say, someone getting their lips filled, and then, that filler kind of starts to break down over a 6 to 9 month period of time.
That's one of the beauties of the liquid rhinos. People tend to get a lot of bang for their buck because of the time that the filler stays, because there isn't the movement in terms of that.
Exactly.
And I think this is one of the real benefits of having, multiple experts from a surgery, from a non-surgical side, is because it's always a tough decision. Do I go back to surgery? Do I not? I mean, it's hard to get 100% everything perfect stuff. And sometimes there's some tiny little tweaks, as Dr. Weinfeld's alluding to, that would make a big difference. And when you talk to our experts here, they may say, hey, look, it's a lot of surgery for a tiny, tiny difference. And there's a chance that something else pops up that you don't love if we have to open and redo it, because it's not as simple as like, oh, let's go in and shave down this one tiny little piece, because it may be a cartilage, it may be a graft, it may be something, who knows, in the specific situation stuff. And so, I know with my own patients, got to really make sure that the secondary surgery, whether it was our patient or somebody else, is really going to be worthwhile. And sometimes after the discussion, it's not. And if there's an alternative that can get them to a great spot, and like Gilbert said, that's going to last them a long, long time, it can be super helpful.
Yeah. Why don't we, just for a second, because really it is about expectations. If patients are going to get what they want, then they're going to be happy, and that's what we all want. And I'm gonna kind of say and ask some of these, because I'm not exactly certain what liquid rhinoplasty can do, but I would say that if someone has a very deviated nose, then liquid rhinoplasty probably is not going to fix that. But if there's a very subtle deviation, you actually can correct it with injecting on the contralateral side or the side. Yeah, okay,
that's right.
So big deviation, surgery. Small deviation, doesn't want to have surgery.
Right.
Filler.
Yeah, I couldn't agree more. And, there's so many different variations to the dorsum of the nose that can occur. We talked about a dorsal hump. Yeah. You can have a saddle deformity. Yeah. You can have, a little deviation or a curve to it. And I think to some degree, liquid rhinoplasty, dermal fillers can impact that in a very positive way. But again, it's temporary, right? And then just to kind of piggyback on that.
But temporary, what are you talking about that? Because I think it's longer than a lot of people think. What would you say a typical patient gets out of a liquid rhinoplasty?
I tell patients...
I know it depends on the product, and maybe you can talk about your favorite product.
Sure. Depends on the product. I tell patients that on average, they can anticipate anywhere from 12 to 18 months longevity out of most.
That's a pretty good temporary result.
Yeah, out of most dermal fillers. And there are some that have a little bit more longevity to them. And again, talking about how, in an area where there's not a lot of movement other than like scrunching your nose, you're not going to see that kind of break down very, very quickly. Yeah. So to your point, some of my favorites, typically on the dorsum of the nose, I like to use something that's a little bit firmer, that has a little bit more lifting capacity when we're trying to create that camouflage for the dorsal hump, or if we are trying to, correct a very subtle deviation. I really like Voluma. I think Voluma is a great product for a liquid rhinoplasty. I've used, fillers from the Restylane line of products like Restylane L or Lift, I think are really great. And I've even used some from the Revance line. I think RHA4 is really nice, but I find that it is a little bit softer than say Voluma. And so you have to use it in the right patient, someone who doesn't need a lot of correction, that maybe just needs something very subtle, but needs something that's going to help lift.
How about kind of going back to what can be achieved, just for my edification? So let's suppose someone has a fair amount of tip asymmetry or irregularities. Is that a place that you can be injected safely with or without ultrasound?
So since I have started utilizing ultrasound in my practice, I do not even attempt to inject a nose without mapping it beforehand. Yeah. Just to preface my answer. So I always will scan a patient, and I will tell them that if I find that there is potential risk that we might see a vessel that is too close to an area that I plan to inject, then I tell them I don't think this is safe for us to do, and I refer them to you for surgical approach. But to answer your question, yes, I think that small asymmetries in the tip can be improved upon. It's one of these things where it's you do a little bit at a time to just really get that symmetry. I always have patients
tell them let's see you back in a week or two. Yeah. How about this area of the nose, the ala? Can you inject that or not?
I'm glad you brought that up because yes. So it can be injected.
It's hard though. Right?
It's hard. Yeah. The network of blood vessels come from the side and kind of converge in the center, and that's why the center is kind of the ideal place to inject, because there is less involvement of those vessels, connecting to one another. They kind of just come up towards the side. Yeah. But one of the things that I do like to do is, for someone who has flaring of the nostril, adding a few units of Botox.
I was going to ask you about that.
On each nostril can really help reduce the flaring because of the involvement of that muscle that causes the nostril to flare. Yeah. And so you can kind of slim the nose down a little bit. Yeah. Now, again, not anything surgical for like an alar base reduction or anything, but maybe enough for them to feel like, oh, okay, this is helping me feel a little bit more comfortable and confident with how I see myself.
What other areas can you do toxin for the nose? Because there's a few other kind of tricks and tweaks you can do.
Absolutely. So earlier I mentioned kind of scrunching your nose, and some people will refer to this as the bunny lines. And so you can certainly kind of target the muscle that creates these lines on the nose.
And I feel like when people get toxin on their forehead, crow's feet, and then don't address the bunny lines, they stand out even more. And it's not that you created them, but now you have those lines when you don't have any other lines. Yeah. You notice them much more.
Yeah. All their expressions come out on their nose.
Yeah, exactly. So that helps kind of smooth that out. And really the only drawback is, if they wear glasses and they're used to kind of scrunching their glasses back up with their nose without having to push it with their finger. Yeah. The glasses are going to slide down a little easier, but other than that, there's, no drawback to it. Yeah. And another great spot I like to use toxin is right at the base of the columella, or the little piece of tissue that separates the nostrils from one another. There's a teeny tiny muscle there called the depressor nasi muscle, which pulls the tip of the nose down when we smile or when we make certain facial expressions, that when you hit that particular muscle with just 2 to 3 units, it relaxes it, and you can actually get a little bit of that tip eversion, or getting that tip to kind of point up and out a little bit, which a lot of patients really like.
I think it's super exciting in terms of this. What about, if somebody's preparing for surgery, is there a time they can get a liquid rhino to time to surgery? Do you just dissolve it if they've had it? How do you approach that, just so patients can make sure they're mindful a little bit about it?
Yeah, no, you can plan a surgery with filler in the nose if you have good photographs of the nose prior to the filler. But I do like to have the filler erased with hyaluronidase, and but I've done it, but also Gilbert's helped a lot, as has Sarah and Jenna. But we really need to get that filler out of the nose before surgery, and because it's an area that we have to be careful with, and because it's an area where just a little bit of inflammation can impact my perception during surgery, I like to do it well in advance, or like at least a month, so that you can then have a second chance to remove a little bit more 2 weeks before surgery. So yeah, you need to get all that filler out to do it well.
And then I think the last thing, and I know we've talked about it in terms of all sorts of other fillers, whether it's lips, cheeks, other stuff, being really cognizant of what you're getting injected in your face, no matter whether it's your nose, elsewhere, because it is tempting to use some materials that maybe aren't FDA approved and can definitely lead to problems. And that even makes doing a surgical rhinoplasty very, very, very challenging.
Yeah. I should say there are definitely some hazards, but the way that Gilbert is doing it is the way to do it, really minimizing risk. Yeah.
So, and correct me if I'm wrong, but I'm going to try and summarize all the pearls of knowledge you guys have said here. So, definitely a spectrum between liquid rhinoplasty and surgical. No question, when we talk about functional septum breathing stuff, surgical is going to have a much stronger outcome. The non-surgical, the liquid rhino, definitely much shorter downtime. I think for dorsal hump, for some slight straightening of the nose can be extremely, extremely effective. I think mixing some toxin can also help with some little tweak stuff. And then it sounds like both of you agree that this could be a bridge to having a surgical. If you just kind of want to dip your toe in, want to get a little bit of a feel, make sure it's something that you'd be excited about. One doesn't keep you from having the other.
Not at all.
Not at all.
No,
yeah.
I think they work so well together, and I think in reality, it only makes the patient much more confident when they do make the decision to have a surgical rhinoplasty.
I think I also love the fact that you brought up that, even if somebody's like 95, 96% of the way happy with their rhinoplasty, but want to do some tweaks, this may be a great option for them. So I think that's a super interesting, and we can always get them into to see you and either get the liquid rhino by you or refer them to Gilbert if you think that, hey, this is a better route for them. And one of the really, really cool things about developing a full team in Spectrum is that, if all a practice has is a hammer, that's all they get. And the idea that they can get kind of the full spectrum of rhinoplasty treatments, I think is super exciting for patients.
Yeah, absolutely. Absolutely.
Well, can't thank you both enough for guiding us through this complex rhinoplasty discussion. And
hope we made it simple.
Hopefully simple. And then a shout to Dr. Weinfeld, who's doing a bunch of big presentations for the Rhinoplasty Symposium in Vancouver.
Yeah.
Actually coming up in about 6 weeks or so.
Yeah.
Coming up soon. So hope all your...
We better air this soon then.
You better air it soon. All right. We'll see you guys soon. Plastic Surgery Untold, greatest podcast in the world, is voted by us. You can listen to us anywhere you get your favorite podcast, iTunes, Spotify, Pandora. We'll see you guys soon.
All right. Adios. Bye-bye.